my name is Sarah. I'm going to be administering a medication through the central line. So before I go into my patient's room, I want to go ahead and just see what he has ordered. He is complaining of pain that is rated 8 out of 10. So I want to go ahead and just assess that. And I would want to make sure that I have all my supplies with me that I would need. So I have all my stuff and let's go in there. So I'm going to knock. Provide for privacy. So, hi Bob. My name is Sarah. I'm going to be your student nurse today. I'm sanitizing. Okay, Bob, do you want to go ahead and just tell me what your name is? And Bob is going to tell me it's Bob Owens, 5/21/1952. I'm going to match that to my MAR. I have Bob Owens, 5/1/1952. Okay, Bob, I heard that you were complaining of some pain. So he tells me he's complaining of some chest pain. It's rated 8 out of 10. And I'm going to go ahead and ask him, do you have any allergies? He's going to tell me he's allergic to morphine. And I'm going to note that. So, Bob, it looks like you have hydromorphone ordered in your chart. You have not received this yet, and you're allergic to morphine, but you could have the hydromorphone. Do you have any questions for me? He's going to tell me no. So then what I'm going to do is I'm going to go ahead and get an assessment on him. I could start with just pulse, respirations, oxygen level, blood pressure. I want to make sure that Bob can follow commands. So something is like, can you raise your arm for me? Can you just stay still? Like something to make sure that he can follow commands. And once that is done, okay, Bob, I'm going to go ahead and just do a quick assessment. I'm going to inspect your PICC line. I also want to make sure that just because he has an order for medication to be given through his PICC line, that his PICC line is still necessary, and because Bob is receiving chemotherapy, it still requires, he still has a reason for a PICC line to be in. So I'm going to go ahead and just throw some gloves on. Okay, Bob. I'm going to go ahead and just inspect your PICC line, okay? So while I'm doing this, I'm just looking that I'm going to use Rita. There's no redness, edema, ecchymosis, there's no swelling. It's not tender to my touch, and as long as that is good, I'm going to go ahead and then take my clothes off because I assessed him. Bob, I'm going to go ahead and just get the medication ready, okay? So he has hydromorphone ordered. I did use the Betty book, but I already did my math beforehand for the purpose of this video. So what I have here is hydromorphone. It is 2 milligrams per 1 ml. Bob can have 1 milligram, so because of that he gets half an ml. When I go to push this, I want to push this over 2 to 3 minutes. That's how much it requires to be pushed. I do not have to dilute this with any saline. But because I'm going to be doing 2 flushes before and after, I want to go ahead and just make sure that this was compatible, and it is compatible with normal saline. The normal dosage is 0.2 milligrams to 1 milligram, and I'm within those parameters. So I'm going to sanitize. I'm going to go ahead and just drop my medication real quick. Okay, so okay, I have hydromorphone. We're going to pretend that there's a garbage right here. I would go ahead and scrub the top of this for 15 to 30 seconds and allow it to dry, or per agency policy. I have a 3 ml syringe. If I prepared this medication outside the room, I would do my med checks and I would label this properly before I came into the room. So I have a blunt tip needle on here, and I'm going to go ahead and inject 5 mLs of air to here because that's what I'm drawing out. Okay, and I have half an ml. I'm only drawing up half an ml. So I'm going to go ahead and just show this to the camera that I have half a mil drew up. So now I'm going to go ahead and do my med checks. So I'm going to compare patient name band to the MAR. So I have Bob Owens. I have hydromorphone. I have hydromorphone. I'm giving this IV through his PICC line, and it's due now because it's PR and he can have it every 3 hours and he hasn't gotten it yet. So I have, and the medication is not expired, as well as my syringes are not expired. I said you don't want to give anything that's expired. So I have Bob Owens, I have hydromorphone, I have half an ml that I'm going to be giving through his IV, it's due now because it's PRN. And then I have Bob Owens, I have hydromorphone, I'm giving half a milliliter through his PICC line, and it's due now because it's PRN. So I do my my 5 rights of med administration 3 times is what I'm trying to say. So once I know that I am dose accurate, I will go ahead and grab my alcohol prep pads. I do have a antiseptic cap for the end, and I want to make sure that I have my timer. Okay, Bob, is it okay if I just lay some stuff on your bed? He's gonna tell me, oh sure, that's fine. So okay, Bob, what I'm gonna go ahead and do is I'm gonna push the medication into your central line. You shouldn't feel anything. We're gonna push over 2 to 3 minutes. I want you to tell me if you experience any pain, anything like that, but we're gonna go ahead and get started, okay? Do you have any questions for me? He's gonna tell me no. And because this swab cap has been on here for longer than a minute, I can go ahead and take this off. And I want to maintain sterility, so I don't need to clean this lumen right here, but I am going to go ahead and connect my flush and to make sure that this is open. And it's open, so I'm going to go ahead and just push 2 to 3 ml. So I want to see what I'm pushing. So I push 2 to 3 mLs, and once I push that and I know that it's patent, I'm going to go ahead and aspirate back. And then once I see that I have blood aspirated back, I'm going to go ahead and push the rest of my the rest of my syringe in using a pulsative technique. And this would be at the same rate that I would give the medication at. And we use this technique to make sure that there is not any debris that's hanging out in the lumen. So now what I'm going to go ahead and do is I want to maintain sterility. I'm going to grab an alcohol wipe. I'm going to swab for 15 to 30 seconds depending on agency policy. And I'm going to allow that to air dry for today's sake. Oh. Bear with me. Okay, there we go. All right, Bob, we're gonna go ahead and push the medication. Okay, and for the sake of the video, I would go ahead and make sure that I push this at the 2 to 3 minutes, but I'm gonna go ahead and just push this in because we don't have that much time. So, make sure that's open. Okay. So then I did that. I'm going to close this in between. And then I'm going to grab another alcohol wipe. And then I'm going to go ahead and keep cleaning this for 15 to 30 seconds, depending on agency policy. Okay, and once that air dries and I'm all good, I'm going to go ahead and attach this last one. Go ahead and open this back up. And then I'm going to go ahead and flush for the first 5 mLs, and once I know that that is able to be flushed, I'm going to go ahead and use the rest of this for the pulsative technique, and I'm doing this at the same rate that I would give that medication. And then before I take this off, because there's positive pressure, I'm going to go ahead and lock this. So I remove this, and then I want to grab, I'm going to grab a brand new swab cap. I'm going to attach this to the end. Okay, so then I'm going to go ahead and clean up my mess. I'm going to pretend that's a garbage. Okay, I'm going to take my gloves off. I got rid of all my garbage. That's Okay, so Bob, I just want to make sure you're still feeling okay. How's your pain? He says it's doing a little better already, which is great. We want to hear that. So I'm going to make sure that Bob is comfortable. I have bed lower down to the ground, his side rails up, his bed table within reach, his call light. There's no obstacles in his way. And then once I make sure that Bob is a-okay, I'm going to go and I'm going to document what I gave, what time I gave it at, and how much I gave it at. And I'm going to document my assessment findings. And then I'm going to leave the room and I'm going to sanitize before I leave. And that's it.